Well, amid staffing issues and facility closures at Glenwood Regional Medical Center, now other area hospitals are getting hit hard. Good evening to you. I'm Jennifer Andrews. Jessica Torricelli reports on how St. Francis is dealing with more patients.
I think these are unusual times and unusual circumstances, and certainly nothing that any of us could have predicted a year or 18 months ago.
Services at Glenwood Regional Medical Center in West Monroe have been under the microscope for the last year, prompting state oversight. In an April legislative hearing, Louisiana Department of Health officials suggested the hospital is a, quote, financially distressed hospital in a dire situation due to mismanagement by their parent company, Steward Healthcare.
It's sad, really, because I began my career as a doctor in West Monroe and on staff at Glenwood, and was chief of staff and on their board of directors for a period of time. And so it's just sad to see the position that they're in, because I know how much that hospital has meant to the community.
Glenwood's situation means other area hospitals like St. Francis Medical Center in Monroe have to take in the patients that Glenwood can't care for with its current 91-bed capacity.
We have seen a significant influx of patients through our emergency room. We've gone from averaging 130 patients a day to about 160 patients a day.
In peak COVID and flu season, Dr. Thomas Scollett, the CEO and market president of St. Francis, says that number could soar over 220 people in the emergency department daily. The hospital has 321 licensed beds, but they are fighting for more to deal with the magnitude of new patients.
In fact, right now, we're having the Louisiana Department of Health reevaluate the status of some rooms and beds to try to expand the number of adult medical beds that we have, especially those that can provide cardiac monitoring, because a great deal of the new patients we're seeing need that service.
Dr. Gillette says they expanded the ER holding area and changed the process to get patients into the ER quicker. The situation at Glenwood is compounding a larger issue, the lack of staff and funding at rural hospitals.
We also are seeing more outside referrals from the rural hospitals in the area. The unfortunate thing is that if you're busy and full, sometimes you can't accept those patients that need more urgent care. And I think we're seeing more of those folks have to leave the area and the region, which is a hardship on them for the travel. Sometimes it delays care, but it also is so much more expensive.
With this changing healthcare landscape, Dr. Gillette hopes the VCOM Medical School will change the future for our region. And he wants people to know St. Francis is not going anywhere.
The care is available, the care is here, people are ready. It just sometimes takes a little bit longer. The problems that Glenwood is facing are not the fault of the local administration. It's not the fault of the team members. It's not ever been a lack of support of the folks in their community. It's just an unfortunate situation caused by a very poor corporate ownership, and we all regret that that's the case.
Jessica Torricelli reporting. We also reached out to Ochsner LSU Health Monroe to see what they are experiencing, and we are waiting to hear back. But in a statement to KNOE, Glenwood said, "We never refuse patients that enter our emergency room, and we accept appropriate patient transfers from outlying hospitals."